Hello, my name is Carly Frisk, and I'm a behavioral health specialist at Milestone HCQU West. I previously worked as a behavioral health specialist at the HCQU for 4 years until my family relocated across the country. I continue to do consulting work for the HCQU and had the pleasure of returning back last year as a part-time employee. I am so happy to be back with this amazing team of people. The HCQU is able to provide so many great resources to the individuals who choose our services as well as their staff. An intensive technical assist, or ITA, is one of those resources that we can provide. An individual's team of supporters will identify if a person is struggling and has an additional need for information or resources. When a need is identified, a person's team is able to request an ITA through the HCQU. The ITA can either be behaviorally based, medically based, or a combination of both. A consultant will contact the team and determine how we can be most helpful to them. Some examples of why a team may request an ITA are if the person or staff needs more education or training on a topic such as a specific diagnosis, healthy relationships, good communication, internet safety, and those are just to name a few. We are able to provide education to the staff as well as the individuals who choose our services. Another example of a reason a team may request an ITA is needing a review of concerning medical information or symptoms, practice with a simulation baby if they are talking about starting a family, or needing resources in the community such as support groups or locating a new therapist. We cannot offer therapeutic interventions or we cannot replace medical advice, but we can offer the best resources possible. The ITA can be such a beneficial resource to the team and to the person receiving support because we are coming in as a fresh set of eyes and a new perspective to find ways that can be helpful. At times, the person in the team, especially if they are working through challenging situations, may be overwhelmed and have felt as though they exhausted all of their resources and options. When the consultant reviews the information for the ITA, we have the advantage of being able to offer new ideas and advice. The HCQU is grateful for the opportunity to help a team and the individual find the best support possible. And again, an ITA is just one example of how we can do that.
My name is Leslie Dolman. I am the MIS Administrator at Milestone Healthcare Quality Unit, or HCQU West, and I've been here for 23 years. The DSP Handbook is a mobile application that's designed for professional and family caregivers, and it's 100% free to download and use. This project began back in 2019 with the first version of our app, which was called Pocket HCQU. And it was really developed for the entire workforce who support people with IDD and autism in our 9-county area. So it included content for everyone from DSPs to program specialists to supports coordinators, and resources were specific to our 9-county region in Western Pennsylvania. But data that we collected through user registration over 3 years showed a couple of trends emerging. One was that people from all across the state of Pennsylvania were downloading it in equal measure. And two was that almost 90% of those people were DSPs, life sharing providers, or family caregivers. So we saw the need and we went back to the drawing board to create a resource that focused on the day-to-day needs and work of professional and family caregivers. We also widened our reach by making sure that any external resources we included were either statewide or national, and we added tons of content on topics like DSP self-care, supporting safe internet use, and grief support. To encourage user registration on the app, we created premium content like delicious, easy, healthy recipes that with step-by-step instructions and pictures, and lots of printable tools and resources. and access to our 52-week video fun and fitness program. Premium content is also free, but users are required to fill out a registration form in order to access it. Gathering user registration data is how we know our users and how we learn about who's using the app so that we can continue to develop content that's relevant for them. The DSP handbook is available on iPhone and Android phones, and we hope that it will be a daily resource for professional and family caregivers that's readily available at their fingertips.
Hello, my name is Denise Quinn, and I am the training coordinator here at Milestone HCQU West. I've been employed with the HCQU for 21 years. Each year, we put together a training syllabus consisting of a variety of medical and behavioral health topics concerning the healthcare of people with intellectual and developmental disabilities. These trainings are taught by our clinical staff as well as other professionals in these areas. This year, we were excited to offer a training series on serving leadership from the Center for Serving Leadership created by Dr. John Stallworth. We train approximately 15,000 people each year through several platforms, including instructor-led, webinar, online, and self-study courses. Through these trainings, we are able to assist agencies and staff to improve the care and quality of life to those with IDD.
Hello, I'm Jaleesa Schatz. I'm the administrative assistant at Milestone HCQU West. I've been here 8 years now, and recently it's been my privilege to bring Next Chapter Book Club. Next Chapter Book Club is a world-renowned club for adolescents and adults with intellectual and developmental disabilities. It's a chance to read, make friends, and just have fun. Friendship is an essential part of life, and people with IDD and autism need that chance to build those connections just like anybody else. Learning is really a lifelong endeavor, and reading is just one of the ways that we can continue to learn. Stories allow us to think about other places, people, and scenarios. It's really more than just an entertaining adventure, it's a learning opportunity. Next Chapter Book Club improves the lives of its members by being a safe, fun place for people to enjoy social connections and learning through peer conversations rather than just the classroom.
Hello, my name is Jennifer Baker, and I have been a nurse at the HCQU for 7 years. Today, I'm very excited to share with you one of my favorite trainings that we do. It's called the Virtual Dementia Tour, or VDT. And this is a simulation training that we do in person to help participants have a better understanding of what it might be like to have dementia. We garb them up in gear that affect their 5 senses, ask them to complete 5 simple tasks while they're in the room for 8 minutes. We have a behavioral observer writing down if they're successful with that, anything else they might exhibit. And once everybody's gone through the tour, then we get together and we have a debriefing session, which is really insightful as we start to connect the dots as to what they've experienced and what a person with dementia might go through navigating their day. We also reinforce the fact that what they might view as behaviors are actually coping mechanisms for that person with dementia. And we provide resources and strategies to help during complicated times. The responses that we've had, it's just that it's a very impactful training. And I think that it helps to elevate a level of awareness and empathy, which in turn helps the support person provide better quality of care and in turn improves the life of the person with dementia and ID.
Hello, my name is Amy Simon. I am a HCQU nurse as well as a certified diabetic care and education specialist. I have been with Milestone for 23 years. As a diabetic educator, I educate and empower people with diabetes as well as their support staff to be able to self-manage their diabetes. I provide expert instructions for people who are on insulin and other non-insulin injectables to give injections appropriately and safely. I also educate and instruct on performing glucose readings. Diabetes is a complex disease that requires daily self-management. I educate people on the importance of making healthy food choices, on staying physically active, monitoring blood sugars and A1Cs, as well as foot care and taking medications such as insulin and others as prescribed safely. I am passionate about providing the tools that help with successful self-management and reducing the risk of diabetic complications such as heart disease, dental disease, kidney disease, eye disorders, neuropathy of the legs, and other nerve damage, and others as well.
Hi, I'm Maggie Voorhees. I have a Bachelor of Science degree in biology. I've worked as a BHS for Milestone HCQU West for the past 7.5 years. Currently, I'm working on projects that aim to improve the lives of people with intellectual and developmental disabilities. I am beta testing our virtual dysphagia program using the Oculus system. Educating people on dysphagia via the Oculus system provides a safe virtual environment to practice preparing specialized meals and learning safety tips and techniques for people with swallowing difficulties. Virtual reality has been shown to have a higher learning retention rate than traditional training. I have partnered with the Growing Together Aquaponics program to provide easy 6-step meals that people can prepare using fresh produce grown from the aquaponics program. This program is entitled Let Us Help with Dinner, pun intended. A diet that includes roughage, such as lettuce, has shown effective to help reduce constipation, the number one diagnosis in the 9 counties our HCQU supports. I created an ongoing hospice program. The hospice program is comprised of items for people near the end of life as well as the people supporting them. Also included are resources and materials to help with grief after the person passes.
Hi, my name's Margie Fenn. I'm a registered nurse here at Milestone HCQU West. I've had the pleasure of working here for almost 14 years now. I just wanted to take a moment and share our excitement about our wellness walk. It takes place at a local mall. It's every other Monday for an hour and lasts for 6 weeks in March. It's an organized walking group dedicated to encouraging a healthy, safe environment to meet other people with the same goals. The participants will receive a t-shirt, water bottle, and pedometer when joining our group. During our wellness walk, we will provide 15 minutes of physical and mental health education and discussion, with each session encouraging lifelong wellness, such as the importance of exercise, healthy food choices, and overall health, and how to get started with these accomplishments.
Hi, my name is Kelly Fisher. I am the clinical supervisor here at Milestone HCQU West. I have been with the company for approximately 17 years. I started my career here as a nurse and then became a nurse and behavioral health specialist. And then finally in 2015, I took the role of clinical supervisor. I would like to speak to you today about 2 different projects that are near and dear to my heart. One of them being the HRST, or Health Risk Screening Tool. This allows providers to take a close look at each person that they support and at their current health risks. This allows the team to mitigate risk by implementing preventative strategies early. So, when we know what the issues are, we can step in and prevent them from getting worse. Part of what I do is that I then take that data and I report it out as a whole for each one of our 9 counties. So I report that to our SCO, or our Supports Coordination Unit, our AEs, or administrative entities, as well as look at it internally at the HCQU in what ways that we can implement strategies to kind of combat those risks. The other project I wanted to talk about is I am currently in my last semester for my certification in forensic nursing. So a passion of mine has always been looking at abuse in the folks that we support, as well as those people who are on the other end of the spectrum, in which, maybe there are some criminal charges and things like that. We know that approximately 90% of the folks that are in our system have been victimized at some point in their lives. Many times it's not addressed. It might be ignored, or it might be minimized. So my hope is to implement change in how we support either people on either side of the criminal justice system, so that they have the possibility of the greatest outcome.
The Psychiatric Med Minute is a monthly video series that we developed to help to educate professional and family caregivers about psychiatric medications. HRST data shows that a large number of people in our system are taking psychiatric medications, and some of them are on multiple psychiatric medications. Some of these medications have the potential to cause significant extrapyramidal symptoms or movement dysfunction, also metabolic changes, and a lot of other health complications. We developed this series for caregivers to give them some basic information about the potential complications and side effects of taking psychiatric medications, along with tips for how to best support someone who is taking them. Each video is less than 5 minutes long to deliver information in easily digestible chunks, which studies show allows for better assimilation of information. Each month, a new video is uploaded to our health and wellness blog and also to the Learning Bites section of the DSP handbook, our mobile application.